Today we are going to compare two serious diabetic emergencies, diabetic ketoacidosis and hyperosmolar hyperglycemic state, also known as DKA and HHS. And clear. So ideally we may extra space Both involve high blood sugar. Both can cause altered mental status. Both can be life-threatening, but they are not the same. With this scenario, imagine you respond to a 72-year-old female. Family reports she has type 2 diabetes. She's been sick for several days. Today, she is extremely weak, very thirsty, and now difficult to arouse. Her skin is dry, her heart rate is elevated, her respirations are rapid. Her blood glucose just reads high on your glucometer. So what is it? Is this DKA or is this HHS? Understanding the difference helps you anticipate severity and urgency. So the big picture difference here's the simplest way to remember it. DKA is about acidosis. HHS is about extreme dehydration. Both involve hyperglycemia, but the underlying processes differ. DKA, or diabetic ketoacidosis, is the most common in type 1 diabetes. It occurs when there is little to no insulin available. Without insulin, glucose cannot enter the cells. The body thinks it is starving, so it begins breaking down fat for energy. When fat is broken down, ketones are produced. Ketones are acids. As ketones build up, the blood becomes acidic. This metabolic acidosis is the key feature of DKA. Some of the signs and symptoms you'll see with DKA: onset is usually rapid, often within 24 hours. You may see high blood glucose, fruity breath odor, nausea and vomiting, abdominal pain, altered mental status, and importantly, deep, rapid respirations. These are called ketoacidosis respirations. The body is trying to blow off acid through rapid breathing. Skin may be warm and dry. Dehydration is present, but acidosis is the primary problem. With HHS, or hyperosmolar hyperglycemic state, this is most common in type 2 diabetes. In HHS, the patient has some insulin. There is enough insulin to prevent fat breakdown. So ketones do not significantly form. That means no major acidosis. Instead, glucose levels rise extremely high and much higher than DKA. As glucose rises, the blood becomes very concentrated or hyperosmolar. This pulls fluid out of the body tissues. The result is severe dehydration. Profound dehydration is a key feature of HHS. HHS signs and symptoms include onset that is slower, often days. You may see extremely high blood sugar, extreme thirst, frequent urination early on, very dry skin, signs of severe dehydration. Altered mental status can be profound. Coma is more common in HHS than DKA, but you typically will not see fruity breath, significant abdominal pain, or ketoacidosis respirations because there is no major acidosis. Looking at a side-by-side comparison with DKA, it's usually associated with type 1 diabetes. It's rapid onset, ketones are present, metabolic acidosis is present, ketoacidosis respirations, and fruity breath. With HHS, it's usually associated with type 2 diabetes. It's slower onset, minimal or no ketones, no significant acidosis, severe dehydration, extremely high glucose levels. Your assessment begins the same way. Scene safety, primary assessment, airway, breathing, and circulation. Check blood glucose, assess mental status, look for signs of dehydration. Listen to respirations. Are they deep and rapid? Think DKA. Are they normal but the patient is profoundly dehydrated and lethargic? Think HHS. Remember, at the MT level, you are not diagnosing lab values, you are recognizing patterns. Treatment priorities are the same for both. Maintain airway, provide oxygen if indicated, monitor vital signs, treat for shock and rapid transport. These patients need IV fluids, insulin, and hospital management. HHS patients are often more severely dehydrated and may be more unstable. Early recognition and rapid transport are critical. So in closing, DKA is a problem of acidosis from ketones. HHS is a problem of extreme dehydration from very high glucose. Both are serious, both can cause altered mental status, both require rapid transport. Recognize the patterns, support ABCs, check the blood sugar early. And remember, not all high blood sugar emergencies are the same, but they are all life-threatening.